Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good day, and thank you for joining us for a quick overview of CAHPS, the Patient Engagement Surveys. I'm Dr. Awoniyi. I happen to be the Director of Clinical Education and Research at Axxess, and truly grateful to be able to speak about the CAHPS surveys. So what will we cover during this time together? We'll essentially talk about the home health and hospice CAHPS surveys and what they are, the requirements, how the survey process works, and how the data is used and how you can leverage that for growth within your organization using the survey results and the star ratings. We know that the challenges in healthcare are many. The Institute for Health Improvement really helped summarize that about 20 years ago with the triple aim. And since then, the quadruple aim has been tossed around. And essentially, what it boils down to is how do we deliver the best patient experience for the greatest number of people and everyone who needs health care in an affordable manner. And we know that the role of the care team that delivers care is absolutely critical. And how do we ensure that we keep them empowered as well? And when we look at a number of baby boomers and the healthcare trust and all these things, we know that these are true existential questions that we need answers to. And we know that patients play a truly critical role because CMS has made that clear that patient-centered care is paramount to being able to truly deliver quality care. These two statements were lifted from a presentation that Seema Verma gave. Our goal is to activate the most powerful force in our healthcare system for creating value, that is the patient, and that we will transform the individual patient into a consumer of healthcare, one that is empowered to shop for the provider that delivers the best care at the lowest price. So we know clearly here from these statements that patient-centered care is not only crucial, but the patient's perception of that care, CMS views as truly driving quality care. Question that might come to mind is, does patient engagement improve outcomes? There's a plethora of studies around this. We've just provided 3 in this example, and sure that if you just search online, you will find that patient engagement truly does drive improved outcomes, especially in engaged patients. So what is CAHPS? The acronym CAHPS stands for the Consumer Assessment of Healthcare Providers and Systems. It was initiated and funded by the Agency for Healthcare Research and Quality, or AHRQ, in 1995 in partnership with the Centers for Medicare and Medicaid Services, CMS. CMS approached AHRQ to really help them develop a way to measure patient experience with their healthcare providers, and the CAHPS surveys are a result of that. We find that the Patient Protection and Affordable Care Act, or the ACA of 2010, amongst a number of other things, enshrined the measurement of outcomes, mandating CMS to create and collect quality outcomes and report that publicly in Section 3004. And so the home health and hospice quality reporting programs were developed. In addition, there have been a number of final rules based on CMS rulemaking that has mandated the surveys be adopted by CMS certified organizations. In the case of home health, that was for April 1st of 2010, and hospice January 1st of 2015. So what is the goal of the program? Well, it's essentially to measure and assess the experiences of patients who've received home health care for home health. And in the case of hospice, decedents or their caregivers who basically complete the survey and provide feedback on the services received by patients that have died. The purpose of the survey is really to help monitor the quality of care provided by home health and hospice organizations through the quality measures and star ratings in the case of home health, and ensuring that by publicly reporting that data, it helps patients in comparing and choosing a provider that will meet their needs, therefore driving healthcare organizations to improve their quality outcomes and the care that they provide to their patients, and using that reported data by extracting from the CAHPS system quality measures and using that for quality improvement activities. So when we look at the rulemaking that brought about the CAHPS surveys, we see that the final rules for 2010 required all Medicare certified home health organizations that serve 60 or more patients in the period of time from April 1st of 2009 to March 31st of 2010. It required them to participate, submit monthly data, also required the submission of OASIS data, and instituted the 2% penalty for non-participation. And so subsequently, for home health, the period of time used for determining participation is April 1st through March 31st of the current year. In the case of hospice, the rulemaking there was released for the final rules of 2017. Medicare certified hospices that serve 50 or more patients in the previous calendar year, that's January 1st through December 1st of 2016, requiring monthly data collection, including caregivers of the decedents, since they would be the ones surveyed, mandating data submission of the hospice information set, or HIS, and the 2% penalty. The final rules for 2021 for hospice has also previewed the fact that the penalty will go up to 4% for non-participation in 2024. So who's a survey eligible patient? For home health, they have to be 18 years or older, covered by Medicare or Medicaid, including Medicare or Medicaid Advantage. They need to have at least 2 home health visits by a skilled provider, that's nursing or therapy, in the sample month and in the preceding month. The sample month, for example, February, the immediate preceding month would be January. So if the sample month is February, they would need to have at least 2 home health visits in January and February in order to qualify. They can't be receiving just routine maternity care, can't be receiving hospice care, and cannot be deceased. And the no publicity essentially means that the patient initiated with the home care organization a request that only those caring for them should receive their information, and that they would not want to participate in a survey. It has to be initiated by the patient and is therefore very rare. And we recommend home health or home care organizations document in case CMS requests that documentation. For hospice, the decedents have to be 18 and over. Their death has to have occurred at least 48 hours after admission to the hospice, and they need to have a caregiver of record that resides in the U.S. or a U.S. territory as a home address, and also cannot be in a no publicity status. Once an organization has a CCN number or the CMS certification number, they have to contract with a CMS-approved CAHPS vendor. They cannot collect the data themselves and submit that to CMS. It has to be a CMS-approved CAHPS vendor. The CMS-approved CAHPS vendor collects that data, submits it to CMS, and CMS, on a quarterly basis, updates public reporting on Care Compare. The only exemptions would be if the organization's CCN was received on or after January 1st of the performance year, or if they did not meet the size requirement. And there is a form that's available on the CAHPS website, which has to be submitted to CMS and approved for your organization to be fully exempt. So once contracted with a CMS-approved CAHPS vendor, the organization has to authorize that contracted vendor to collect and submit the survey data, and then on a monthly basis submit a patient report. The survey vendor applies eligibility criteria to generate a sample frame, and from that sample frame, they'll select a sample, survey those patients that are sampled, collect the data, format it, clean it, review, submit it to the CMS data warehouse. Once that's accepted on a quarterly basis by CMS, they will also do some additional processing and publicly report that data on CareCompare and also make that available in CASPR for the quality measures. There are only 3 approved survey modes. That's mail only, telephone only, and mixed mode, which is a mail survey followed by telephone calls. With mail only, 2 surveys are mailed over a 6-week period. The first survey is mailed. If the patient does not respond, a second survey is mailed. Either survey that's returned will count, and that data extracted and used for reporting purposes. In the case of telephone only, throughout the full 42-week period, 5 attempts are made to reach the patient, and the data collected is reported. With mixed mode, the first half of that data collection period is a mail survey. If they have not responded, 5 telephone attempts will be made to reach the patient. And again, either the mail survey or the telephone results will be used for reporting purposes. Once the data is collected, in the case of home health, there are 34 questions. That data is reported as composite measures and global measures, meaning that those 34 questions are rolled into either 3 composites or 2 of the questions are used as global measures, as shown here. And once those are reported publicly and become available for potential partners or for patients and their families that are looking for home health services to use to determine the kinds of services provided by the organization. Hospice has 47 questions. Those 47 questions are rolled up into 6 composite measures and 2 global measures similar to home health, and that's how CMS reports that data on CareCompare. The individual question and the responses are available from survey vendors, and those are provided to home health and hospice organizations and should be used for ultimately improving the individual questions and subsequently will improve the composite and global measures that are publicly reported. Here's an example of composite from hospice, which is training family to care for patient. And question 23 happens to be one of the questions in that particular composite about how well the hospice team gave training needed to help the family member if they had trouble breathing. And the responses are used to determine top, middle, and bottom box scores. So, as mentioned, the survey results are reported, and there's a penalty for non-participation, which we've reviewed, the 2%. The data for the CAHPS results for home health are also used to generate star ratings. Those star ratings we know will eventually come to hospice. There's not been a specific timeline, but CMS has indicated that they're working towards that. And those star ratings are used by potential partners or referral sources in determining who they want to partner with. And their organizations will let you know that they've missed out on opportunities either because they did not have star ratings or because their star ratings were not 4s or 5s or even 3.5s, and therefore they could not participate in competitive bidding. We know that, as indicated by CMS, patient-centered care is critical, and with the shift towards value-based care, in the case of home health, the home health value-based purchasing pilot program or model system is going to be rolled out nationally based on information released by CMS. We know there are a number of the CMS Innovations Program where they're piloting hospice benefits with the value-based insurance design model, or the primary care first program for seriously ill population, which is more palliative care, or in the case of NHPCO, the We Honor Veterans Program, which is being done in partnership with the VA and has a number of different steps that CAHPS, or patient experience surveys, feature in all of these future trends. And we don't know what other programs will be introduced, but we know that because patient-centered care is the focus of CMS and where we're going with value-based care, that ultimately we all need to know for our organizations what patients experience as they go through care. So everything from onboarding and survey all the way through to follow-up and discharge, and everything that occurs in between is part of that patient experience with our organizations. And the CAHPS surveys are a critical component, all of that. So what are the key takeaways? Patient-centered care is crucial to achieving quality outcomes, improving efficiency, and reducing costs. The CAHPS surveys are a reporting requirement. They're publicly reported and therefore help attract potential referrals, partnerships, and ultimately growth. And we know that with value-based reimbursement, it only becomes that much more crucial for us as organizations to continue to deliver the best care to all the patients that we see. Want to thank you again for your time and for learning more about the CAHPS survey and how to use that to engage patients.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.